Constipation can be a life-threatening issue for autistic people and people who have a learning disability, who are at increased risk from complications if it's left untreated. The Learning Disabilities Mortality Review, also known as LEADER, in 2019 found that 23% of deaths identified constipation as a long-term health problem. This includes both autistic people and those who have a learning disability. People who have a learning disability may be less likely to recognise the symptoms of constipation, and as a result, be less able to communicate these symptoms to those people supporting them. An autistic person may not feel some of the symptoms of constipation due to hyposensitivity to pain or having poor interoception, which means that they may not be aware of how their body is feeling. So this is why it's vitally important for professionals and carers to understand the signs and symptoms of constipation and to act and seek support when needed. The bowel is part of our digestive system, and it works to digest the food we eat, absorb the goodness and nutrients into our bloodstream, then process and remove the waste that the body cannot use. The digestive system works by pushing food through the intestines, which usually takes between 24 to 72 hours. Muscular contractions, known as peristalsis, squeeze the food through the different sections of the intestine. The passage of food from one area of the intestines to another is coordinated so that food stays in a specific area for long enough for the gut to do a particular job. The small bowel absorbs nutrients, salts and minerals, and the large bowel absorbs water. A healthy bowel gets rid of waste by producing a firm, easily passed stool. Some people may have a bowel movement 3 times a day. Others may open their bowels 3 times a week. The most important thing to remember is that everyone is different. This is why it's good to know what someone's normal bowel routine is. That way, if there are any changes, you can seek support for them sooner rather than later. A normal bowel motion should not cause pain or discomfort. There should be no bloating or bleeding, and there should be no need to strain. As carers, one of the best ways you can help monitor signs of constipation is to use something called the Bristol stool chart. The NHS uses the Bristol stool chart to help identify healthy and unhealthy stools. Type 1 are hard lumps that are difficult to pass and could indicate constipation. Type 2 is sausage-shaped but lumpy, which again could indicate constipation. Type 3 is sausage-shaped with cracks on the surface, and this is considered ideal. Type 4, smooth and soft like a sausage, which again is considered an ideal stool. Type 5 are soft blobs with clear-cut edges, which might indicate diarrhoea. Type 6 is generally fluffy pieces with ragged-looking edges, or it could be mushy, which might indicate diarrhoea. Type 7 is watery with no solid pieces and entirely liquid because it spent the least amount of time in the bowel. This might indicate diarrhoea. If your poo does not look like type 3 or type 4, it could be constipation. Constipation is a condition in which there's difficulty in emptying the bowels. Constipation can cause your stools to be hard or lumpy, as well as unusually large or small. The elderly, people living in care homes, or those who have dementia, people who have learning disabilities and or autism, people on polypharmacy, those who take 3 or more medications, people with neurological conditions such as Parkinson's disease, people with depression, children, people who are at end of life, pregnant women, people who are immobile or who have limited mobility, people who are recovering from surgery, or people who have bowel disease such as Crohn's, diverticular disease, or cancer. Abdominal pain, cramping, or bloating, tiredness and fatigue, nausea, feeling sick or being sick, halitosis or bad breath, incontinence of urine or faeces, retention of urine, not being able to pass urine or having problems with an indwelling catheter. It's often difficult to identify the exact cause of constipation. However, there are several things that contribute to the condition, including poor low-fibre diet or low fluid intake, immobility or prolonged bed rest, metabolic disorders such as hypothyroidism and hypercalcemia, not going to the toilet when you need to go, the environment, having no privacy or having to use a commode or bedpan, not sitting correctly on the toilet or having a poor position before you need to open your bowels, lack of time or being rushed, changes in routine, working nights or travelling, medication, making simple changes to your diet and lifestyle can help treat constipation. To help keep your bowel movements soft and easier to pass, you can support people to do some of the following. Eat a healthy balanced diet and include fruits that contain sorbitol, such as apples, apricots, grapes and raisins, raspberries and strawberries. Sorbitol works by increasing the amount of water your intestine absorbs. This softens the stool, making it easier to have a bowel movement. It also increases pressure, which prompts the muscles in your intestines to move stool. Drink plenty of water and other fluids and avoid alcohol. Extra fluids help keep the stool soft and easy to pass. Gradually increase the fibre in the diet. Dietary fibre increases the weight and size of stool and softens it. In general, a bulky stool is easier to pass, and this lowers the chance of constipation. Add some wheat bran, chia seeds, oats or linseed to their diet, as that will also help. Improve the toilet routine. Keep to a regular time and place and give the person plenty of time to use the toilet. Do not let them delay if they feel the urge to open their bowels. When you need to go, you need to go. Delaying can cause constipation and discomfort. To make it easier to open the bowel, try resting their feet on a low stool while going to the toilet. If possible, raise their knees above their hips. Consider increasing their activity. A daily walk or run can help keep people regular. Exercise reduces the time it takes food to move through the large intestine, which limits the amount of water your body absorbs from the stool, and this makes it easier to pass. We know that not everyone likes to talk about bowels and going to the toilet, but once you've got over the embarrassment of talking about this, you'll be better able to support someone and potentially save their life.